I will do a quick introduction. Our speaker today, Patti Artley, is the Chief Nursing and Chief Clinical Officer at Medical Solutions. With more than 35 years of nursing experience, she works closely with chief nursing officers across the country to understand their needs and help solve today's biggest clinical staffing challenges. Before joining Medical Solutions, she served as the Chief Nursing Officer at the Medical University of South Carolina, where she still teaches as an affiliate assistant professor. Patty earned both her bachelor's and master's in nursing from Penn State and her doctorate from Old Dominion University. She is also certified as an advanced nurse executive. Patty, thanks for being here today. And at this time, I will turn it over to you.
Thank you, Kristen. I appreciate that. So, just a little bit about, let me just get a little bit oriented to Medical Solutions and why we're going to be talking about this. But Medical Solutions started in 2001 as really a contingent labor program in Omaha, Nebraska. And since then has truly evolved to become a workforce partner. And in our ecosystem, we manage the service, the strategies, and the technology with our partners and really help them reimagine where they're at. And today we're really going to talk about what are those things that are causing burnout, because we know that that burnout leads then to turnover. And we know that in order for us to retain our teams and our top talent, we know that we need to create a wellness culture. We know that we have to create the type of culture that they want to come to work in. And then that'll also just have us talk a little bit about top of license and why it's so vitally important, because individuals who want to work in their organization want to make sure that that's really the focus, that they can practice top of license, and then how to maximize our team and the environment in which they are functioning. So I always think it's important to start with why are we here today, and what are we here to focus on? And when I think about just basics, it's around some statistics. And when you think about almost 200,000 individual jobs, the Bureau of Labor Statistics are telling us year over year, till 2032, we'll be seeing that almost 200,000 jobs vacant and being recreated. When you think about that personally to your organization, that costs about $60,000 for every nurse that turns over. And even more importantly, that it's almost 3 months before we actually are able to recruit an experienced nurse. And when you look at the operational definition of experienced nurse, it's gone from 3 years to 1 year in time. And then when you think about the impact across the board, Becker's came out with some interesting statistics on this, where it's almost $250,000 for each 1% impact. So if you could drop, or I could drop my turnover by 1%, we'll save over $262,000 in our bottom line. So I think this was such an important statistic as well. When I think about the importance of how our programs have grown and why nursing is so important. So one of the things that came out as well in the U.S. Bureau of Labor Statistics is that we have drastically increased by 48% the number of job openings that we have in the healthcare and social care sectors. So when they take item by item, all of those jobs that are in the hospitals, that are in healthcare, or any of those social areas, we've gone from 1.2 million to 1.8 million in a matter of those 4 years. So we're all competing for the same talent. So it's important that we are creating a place where people want to work. And I think this is such a vital problem for nursing, because when you think about workplace violence and incivility, these are some of the reasons why nurses have year over year said that they would leave the profession or that they would leave organizations. And workplace violence is at an all-time high, but I think that's because of reporting. we have gotten better about saying, please report and please make sure you let us know so that we can take care of that person. But one of the things that I think is so important is that nurses experience the highest level of incivility and bullying, and that came from OSHA. So OSHA shared those statistics. And I think another reason why we truly have to pay such attention to this is that hospitals over all other industry have 34% more lost days of work. So that's pretty monumental when you think about the cost of that. 34% increased lost days of pay because of injured workers from workplace violence. So when we think about the impact in healthcare, I'm going to break it down from the individual, and then we'll talk about how that impacts your organization. But when you think about how that impacts your care team, it causes that horrible psychological distress. When you think about just the incivility and somebody saying that you don't know what you're talking about, or they bully you, and the difference really between that incivility and the bullying is that the incivility is that rude and challenging kind of behavior that might exist, and the bullying is when it continues. So when you think about being exposed to that day after day, over and over again, it causes that psychological distress. And then I start second guessing myself and I start thinking, are they right? Is that something that I should be thinking about? And I create this self-doubt. And then they lack the confidence that they have. So when they're making decisions, they just continue to second guess themselves, which obviously contributes to low morale on their part and then contributes to the burnout. And the burnout that we're seeing today is very different than the burnout that we saw when we had COVID, because the moral distress is very different. And implications to the hospital. Of course, we have all heard, I need a mental health day, and the call outs then start happening. And then from the call outs, you get to a point where either you have to manage them out because they're not showing up to work, or they leave electively. And then that turnover leaves a gap in the care that we're providing. And so we know that ineffective patient care leads to poor patient outcomes. And then, of course, we just talked about how expensive it is when you think about the turnover. So that all adds to increased cost of care. So I'm going to start with a challenge and ask you to put your answers in the Q&A. But when you think about your biggest challenges, those things that are causing a lot of turmoil for your teams, what are the things that you've done in addressing burnout in your organizations? So we'll give a few minutes and put your answers in is it the Q&A or the chat?
Yes, you can go ahead and drop those answers in the Q&A. We had plenty of engagement at the beginning of the webinar. So the same spot that you answered how you manage stress, go ahead and drop in this question that Patty's asking now. Oh, we just got our first answer come in.
Great.
Pull more weight so the team can breathe.
So that must mean we have more leaders picking up and doing more.
Next one says topic of discussion at management team meeting. Stress behaviors immediately. Another one coming in here. Mental health program for all staff.
That's great.
And give staff permission to talk about their stressors in a safe environment. Someone says normalization of stress responses and use of critical response team.
Great.
And someone else said EAP.
Nice. Well, we're going to hit on all of those. So that's great. Thank you all for being so engaged. So when we think about um, the struggle, I think it's really important as well that we talk about newer nurses. So one of the things that I think was really important was the advisory board really looked at this as a whole, because nurse turnover in 2023 was at an all-time high at 33%. And when you dissect that and you look at overall nursing turnover, it had dropped to 18. So when you looked at overall turnover back in 2021, we hit the all-time high, which was, if y'all remember, 27%. So we went from a drastic 27% down to 18% in overall turnover. But when that first year turnover went to 33%, so they were in their job less than 1 year, that means every time you hired 3 nurses, one of them was leaving as a brand new nurse. Here are the things that they did. So the advisory board dug in and said, why are people leaving in that first year? And what they recognized was that preparation to practice gap was pretty significant. So rewinding back in 2020, 2021, many of our students who were going through their training, very different than when I was training, where you spend a lot of time in the clinical arena. They were spending their time in the simulation labs. So these individuals felt that they were ill prepared, and in many cases, they were ill prepared in a different way than what many of us would have thought. So they felt clinically competent, but they did not feel that they were able to have the kind of conversations, whether it's patients and families, whether it's with nurse to nurse or physician. And I don't know about any of you, but I have Gen Z who would like to text me and ask me what's for dinner, and she's in her bedroom and I'm in the kitchen. So it really is their form of communication, and their safety net was to text or to have that kind of interaction versus the verbal. And then we compounded that because much of their time was spent in the simulation lab. So they weren't really prepared to have these kind of conversations. And then inadequate onboarding and our preceptor gaps. And so we had baby nurses orienting baby nurses. So that novice to novice transition was drastically impacting the way they felt prepared for their first year in a hospital setting. And I know I'm as guilty as anyone else, because I know that we didn't have any other choices at times. We had novice nurses, even though we relooked at the way we were orienting, we had novice nurses who had been out of on our units for maybe 8 months orienting brand new nurses in the beginning of their orientation. But it was because of what we had to work with, right? And then new nurses also said they were not emotionally or physically prepared for those 12-hour shifts, for the long hours that they would be on the units. They did not acclimate well to the night shifts, did not anticipate working the kind of weekend hours that they were placed on. And then the other thing that they identified was that they saw a lot more toxic interprofessional relationships than they had ever been prepared or ever recognized would be taking place. So these are the 3 themes that came out of that. And so it's important that we really think about, how do we manage this first year nurse in a very, very different way than what we have in the past. So now I want to kind of shift gears a little bit and talk about why workplace wellness is so critical. And the Association for Critical Care Nursing really came out with this, and then it was compounded in a study by the AACN, where the colleges of nursing really dissected those organizations that have wellness programs, why they're so critical. So starting right from what we were talking about, right? It decreases your burnout and your turnover. And it really does contribute to the fact that you're paying attention to the whole person and that you truly care about them. You're not just looking at their physical well-being, but you're looking at that, supporting them emotionally and mentally. And those organizations that have workplace wellness programs in place really do embrace the person and then create a different level of engagement. And productivity is increased for those organizations that can engage their workforce in a very different way. And last but not least, why we all are in healthcare is to improve our patient satisfaction and the outcomes for our patients. So I know I could pick from a lot of different organizations because we have a lot of different programs out there that share workplace wellness and really do focus on the burnout and well-being. You know, how do you address well-being? How do you address the burnout and create a more well-rounded place to work? And I'm sharing with you the one that is Chartis, and it's the one I used when I was the chief nurse at Medical University of South Carolina. So I contracted with them to come join us at MUSC and help us really create a different environment. And this was an opportunity for them to come in and survey our team members. And what they said to me at the beginning, because if everybody remembers back in 2023, we were really focusing on bringing the joy back into work. And so we had our teams really working on how do we bring the joy back into work. And we were talking about the gratitude and how do we create that level of gratitude and appreciation. And when Chartist came in, they talked to us and asked us to stop until the burnout survey was completed. And they liken it to Maslow's hierarchy of needs. And so your basic needs have to be met. And under basic needs, what they're talking about are things like, do they have access to water? Do they have time to go to the bathroom? Do they have the ability to get their breaks and lunches? Those are the kind of things that are under basics. Under safety, it's all that workplace safety, right? It's making sure that we are keeping our individuals safe, creating an environment where we're supporting them and they feel supported. Under respect, it's that their voice is heard. Do they have access to leaders that can make a difference when they raise their concerns? Do we give them vehicles in which they can create the problem statement and then help with the solutions? That's what's under respect. Appreciation and gratitude, only can that and joy in the workplace take place when those other three foundational methods are met. So I'd like you to think about your organization and what practices have you implemented in your teams that really support that workplace wellness? How do you support your team to improve the morale that's taking place in your organization? So take a few moments and put that in the Q&A section. Put your comments there, and Kristen will read them out for us.
We have a few. So we've allowed employees up to 3 days of no questions asked mental health days. Someone also said EAP for the days that they are already stuck at work, bring in some food or play a game to brighten the day. If there are any others, go ahead and drop those in the Q&A. Someone has a very active wellness team that focuses on that. Someone also said problem solution based conversations. We do a morning mingle, breakfast, and mental health or de-stress game. We offer a wellness day to employees, group activities, critical response support, working on a kudo board. A lot of great answers.
They are. We're going to hit on those.
Wellness Wednesday tips get sent out organization wide. Someone says a monthly facility wide appreciation treat. Food, positive attitudes, continuous rounding, and Chick-fil-A.
Nice. I love the food. You know, nurses love to eat. It's amazing. No matter where I go, no matter where I work, that's what I found we always seem to go to because we don't get our breaks and lunch like we should, right? So that's part of the problem. All right, well, let's talk about building that culture of wellness. Just like every other change management theory, we really have to get to the bottom of what are the issues and what's happening. So you're going to bring together your stakeholders, and making sure that you have stakeholder groups from every avenue of your organization are so critical. And I was just asked this when I was doing a rural health program, and they said, when we don't have very many people, how do we create these advisory groups, or how do we create these stakeholder groups? And I think this is where you get creative, right? It doesn't have to be that you come and you sit down and every month you're talking about the issues. Do they have a vehicle or a way that they can share some of their concerns in order to make sure that you're paying attention to the right things? Because we all have limited resources, and it is so vital that we know that we're paying attention to the right things. And I'll tell you a story that when I did contract with Chartis, I had 4 emergency departments that I was responsible for on the peninsula. We had a children's hospital, we had a specialty hospital, we had an adult large emergency, and then we had a small behavioral health that had very different challenges in each one of them. And where their burnout issues were, they were all very different. The things that they were wrestling with were drastically different. So it's making sure that as an organization, you're paying attention to the most important information, and making sure that everybody sees the data. We're all looking at the right things. And we used to have all of our executives get every incident report that was filed related to workplace violence. And I think that's a critical element that you get to see, and you make it personal because you're seeing how this happened or what response happened. And then I would send a personal note to each one of them to say, I saw your incident report. I'm just following up to make sure you're okay. And while I did that as the chief nurse, and I always had a response, there was never, not one individual that I sent something to that they did not respond to me. But we also put infrastructures in place to help with that, but more to come on that. But to design and implement that tailored wellness initiative that makes sure that you're paying attention, like I said, to the right things, and reinforcing that you have a lot of things in place, similar to what we've just heard, right? There are EAP opportunities that are all out there. But if we make our individuals go to EAP, that's called an opt-in. When we change that and we do something that opts out, that means that we take it to the individuals that have been harmed. And so what we did was we created an opt-out type of environment. So you place the individual in a place where they can go. So as a wellness coach, maybe I would go to the individuals who were harmed and ask if they were okay. Or EAP during COVID, we deployed individuals to go to the units, and then the individual has the opportunity to say, I'm fine, I don't need the added support. But it truly does make a very big difference in the impact to the employee, in their ability to feel supported when we leverage those things that we have in place and just turn them from opt-in to opt-out. And then really thinking about, what are those never events? What are those things that you are not going to tolerate? And I was just working with a client where I was on site. And when you got into their organization, right as you enter the building, it says, be kind to our teammates. There's somebody's daughter, there's somebody's mother, there's somebody's spouse. And it was a picture of one of their own individualized, and they personalized it and individualized it and said that there is a zero tolerance for harming any one of our care team. And so I thought it was really impactful. So it's thinking about, what are those things that you're not going to let go? And then making sure that these are, any one of these, and I'm going to give you a lot of different things that I'm going to share with you. So think about this slide. is there one thing that I could potentially take out of this one slide? And is there something that I could do or our organization could do to potentially make this better? I heard a lot about the behavioral response teams, and this is a great opportunity because not only is it the person who is impacted, but the entire team is impacted. And I know that as leaders here, I'm sure we've all encountered where you have that patient on your unit or a family member on your unit that it's hard to get an assignment around, right? Or you have to rotate because you can't just keep putting the same person in those rooms because it impacts not just that one person, it impacts the entire team. Behavioral incident response teams allow that team to take a step back and they go in and manage the messaging. They manage contracts, behavioral contracts for families. Code Lavender is a great opportunity when incivility is taking place. It's that zero tolerance, and you're not in it alone. It's that somebody else on the team is coming and backing you up and making sure that you feel cared for. Career coaches, a lot of organizations have these career coaches. They've been paying attention to focus on your professional development, making sure that there is that career pathway. And they also pay attention to your well-being and how you're doing. And that's one of the things that a couple organizations that we work with have kind of framed the career coach, and they've kind of turned it into an opportunity where they start the entire conversation with, how are you doing? And it's just that, how are you doing? And being able to support them in a different way. And then I have to say this happy hour. I've observed this twice now at two different places. And this is that last hour. So a lot of organizations, a lot of times will have those, what are the, that last hour, 6 a.m. to 7 a.m. And they get together at 6 a.m. And when you're giving charge report, this is a great opportunity. They take it and they highlight anyone who has helped them throughout the day and made them get through their 11 hours thus far of the shift, and people they want to recognize. Sometimes it's somebody outside of their unit, like the housekeeper who was called to empty the trash in one room that was really bad, and they took it upon themselves to empty everything in the room, even though it was out of cycle and out of rounds. Or the individual who helped them, that was the tech on the unit, jumped in, and before they were even asked, we're changing the patient who was incontinent. And so they really did take this opportunity to layer in that level of gratitude and make it a positive experience. And they created that plan for the last hour where it was all hands on deck, and how do we get everybody out of here on time? And so I really do recommend that one. It was a really positive encounter in the units, really well received as well. Peer wellness coaches. So these individuals are not only coaching, they're running programs on units, they're going to the units, to especially those high risk units that are struggling right now. But they also got the incident reports. So these individuals would get every incident report that was related to workplace violence or incivility, and they would go to the units and they would schedule time to meet with that nurse, with that tech, with the respiratory therapist that was harmed. And they would walk through, how do they help them and what resources do they have in place to support them. Healthy work environment councils. There's a lot of organizations that are moving into these healthy work environment councils. And these are the groups that are really diving in and saying, these are the things that we should be paying attention to. And then, of course, those benefits that are the wellness and mental health days, how you make sure to support in a different way. And I was just in an organization this past week that shared their opportunity. They actually have shifted it, and if you participate in the wellness program, you get less, you pay less for your benefits because of it. So they've taken it to the financial impact of the organization as well. So I'm not going to go through each and every one of these, but staffing right now and making sure that you are providing flexible options to your team is critical. And when we think about the impact, for so long, we've been doing primary nursing, we've been running 12-hour shifts for a very long time. And when you think about how do you keep your workforce engaged and be there in a different way, we're going to have to get creative. And our Gen Zs are saying this to us consistently that they want more flexibility in their work schedules. So self-scheduling is a must. We really have to think outside the box. We really have to get creative. And I know that sometimes self-scheduling is a little bit more work than when we have the leaders doing it, but this puts a little more autonomy on there. And by self-scheduling, I do not mean that it's a free for all. What I do mean is that this is the opportunity with guardrails and with guidelines for them to take a little bit more ownership and create that schedule themselves. And then there are a lot more organizations that we are working with that are now moving to that split shift so that individuals, if they want to work side by side, they have a partner and they come and they split them. So some are doing, instead of 6 12-hour shifts in the day, or in the 2-week pay period, they are doing 3 days and the other person's doing 3 days. In other organizations, I'm seeing them actually split the shift of 6 hours and 6 hours. So they have to work the exact same day on those, but that opportunity is really keeping their older nurses at the bedside a lot longer. So one of the other things that I think is very creative as well are some of those things like the seasonal work. So a lot more organizations are doing seasonal work because we all know that there are opportunities in our organization and there are units that probably spike at different times of the year, especially I think about the winter months. And we have a hospital that I work with down in Florida that runs the seasonal nurse, and they've been doing it since the early 2000s. And what they do is they let them work from October to April full time, and they have them there for that time frame. And then they work very part-time, very minimal, 2 days in a pay period during the summer months. The one hospital only makes them work during the winter months, and then it's optional for the rest of the year. They're paid at a 0.65 for these organizations, and they get benefits as well. So it really does help keep nurses who are either working as in that snowbird area down in Florida, or it's engaging your individuals who might have school-age children and have a real challenge getting summer care. This is a great opportunity for them as well. So it's really what problem you're trying to solve and think about what's going to give you your biggest bang for your buck. The other thing that I am seeing a lot of is making sure that you're maximizing your resources. You know, when you think about these resource pools, so we have float pools that support the individual organizations, but to really think about how do you get more creative, and as more hospitals are being acquired and more mergers are taking place, how do you create an infrastructure that allows you to move your individuals throughout the other organizations, but they're still part of your plan and of your organization? So really just think through, what are some of those things? What's the problem I'm trying to solve? And what are those things that I could do to create a better environment just as far as the scheduling system? And I'd be remiss, as we're talking about decreasing the cognitive workload, decreasing burnout, increasing support to your year one nurse, if I wouldn't mention virtual nursing. And virtual nursing, I think, came about and really boomed. You know, it's been in place since the early 2000s. So early adopters started in this space in 2000s. And in that early 2000 timeframe, it was very rudimentary, and it has continued to evolve. And when you look at the technology that is out there, there are a ton of different programs, and some of them our infrastructures through a smart TV. Others might be looking like more like an iPad on a cart. But this gives an opportunity to support the new nurse in a very different way and remove some of those tasks that it might need a nurse to perform, but at the same time, this gives this nurse a much different experience by having a virtual nurse with them. And when you think about being able to remove that cognitive workload for the nurse, this is a huge opportunity for you to keep nurses at the bedside for a much longer time frame. And I wanted to share a case study because I think they did it a lot better than I had done it. And when I was in their organization, I thought it was instrumental in how they really went about this. So they hired a company to do their burnout survey for them. And they took their information and they looked at it in a multitude of different lenses. And they looked at what their healthy work environment, they already had a council up and running, and they looked at what they were working on. And what they recognized is that they were continuing to get requests from all over the organization. And these individuals were asking them to work on things that really weren't contributing to the well-being of their teammates. So they looked at the data in a very different way and said, only one, we're going to parse this into 4 different groups. And you have to come up with one thing that you are going to work on and what that challenge will be. So I'm going to start with what they challenged all their units to work on. They gave them their data from the burnout survey, and they said, you need to pick one thing that resonates with your team and what you're going to change. So that was the unit-based team. And then your healthy work environment, because so many people in the survey said they didn't get breaks and they didn't get lunch, they challenged them to really think about how do they address it. So their healthy work environment council really did a deep dive, and they looked at all of these different ways where they could get individuals breaks and lunch. And they came up with 2 options. So each unit had to adopt one of those 2 ways of doing things. And in order to hardwire it, they actually made a KPI where they had to submit online to the central staffing office how many people got their breaks or their lunches during that day. So they built in the KPI to that. And then what they did was they either chose the buddy system or they had to schedule breaks and lunch, and they committed to a pulled out charge. So that group was really working on that. Their organization launched an incivility campaign, and they took on the incivility that was taking place between interprofessional groups, nursing to providers, maybe unit to unit, but they really worked on their organization incivility campaign. And similar to what I shared with you when I walked into that organization, they put it in every elevator. They put these signs on their website. They were front and center in every ambulatory clinic to talk about their commitment to their teams. And then their nurse executive council tackled their onboarding process. And they recognized that what year 1 was looking for was very different than what maybe year 1 or needed was very different than what year 1 nurses in the past had needed. So they revamped their entire onboarding process. So the individuals, as they came on, were welcomed in a very different way. They ensured that they had preceptor support in a very different way, and that they met with their team members on a consistent basis. What they did, and they started this journey in 2022, what they did by 2024 was decrease their nurse turnover. Both year 1 was by 3%, but their overall turnover was decreased from 19 to 17% last year. So it went from the 19% to 17%. And so when we think back, it was $262,000 for each decrease in their turnover. This group yielded over $500,000 in turnover savings just by the things that they did, these 4 opportunities. So, in summary, I really want to highlight that the mental well-being and paying attention to the mental well-being of our teammates is critical. It's something that they're expecting, it's something that they're looking for, and this will be a non-negotiable. I do want to share as well, we did a survey with our teammates at Medical University of South Carolina when I was still there, and we asked them when they felt they made the choice whether or not they were going to stay. And we had a significant number said they make the choice in the first 2 days of being there. And then it increased to 80% of our individuals said they knew before they were out of orientation if they were going to be supported and stay. So paying attention to how you care for them is critical for your retention and job satisfaction. Making sure that you are addressing the workplace violence. Everybody is entitled and should expect to come to work and not have to deal with incivility. And we know this has been going on. It's a lifelong problem that we've been dealing with for years. But as leaders, we have to put the infrastructure in place to make our teams feel supported. And we have to be able to provide that level of support in an opt-out manner so that they truly do feel supported and not like it's one more thing for them to do. And then the wellness programs truly will make an impactful change in how you truly are caring for your patients and your families and your staff. Because if you think back through, when you have an engaged workforce, it really does increase productivity and engagement, thus impacting your patient and family outcomes. So with that, I'll open it up for some questions. I know I gave you a lot of information. And what I hope that you'll be able to think about are what are those 1 or 2 things that might be very impactful for your unit or for your organization. So questions?
So we did have a comment come through when you were on the slide about proven workplace support, saying that she loved those ideas. So thank you for that information. Also have somebody asking if a copy of the slides will be provided to participants. And that is a yes. We will send out the full presentation as well as the recorded webinar from today following today's call. Somebody is asking, was the burnout survey done by an outside party?
Yes. We contracted with Chartis. We looked at probably about 4 or 5 different companies, but that was the one that we went with.
Okay, we have another one. How do we ensure that flexible scheduling doesn't create inequity or resentment among staff members with less flexible roles?
Well, that's a really good question. You have to make sure that you're doing it in a fair and consistent way. So just because I'm offering it to one person doesn't mean I'm only offering it for that one person. You have to be able and willing to do this on more than one occasion. So if I were to ask for that ability to do that, I opened it up to my team and said, we're looking at flexible options. Are there anyone who wants to do split shifts, or is there anyone who would like to participate in this opportunity? So making sure that you're putting it out there. I used to do it in staff meetings. So when we were coming up with new scheduling options or opportunities, when we were changing our guidelines, that's a great opportunity to make sure that you're offering it to everyone, and then you execute on that flexible scheduling.
Okay, next question. How can we better support new nurses who are entering the workforce and already feeling overwhelmed?
Yeah, that's a really good question. So the first thing, I think it starts before you hire them. I think the best opportunity is bringing them in as externs. If you don't have an extern program, it is a great pipeline. So this is a great opportunity for them to learn how to balance a group of patients and not be responsible for their total care, but how do I get acclimated to the healthcare setting? And then they do so much better from a perspective, I'm going to be hosting one of our partners in a webinar, and the things that they've done, they've only hired from externship. They started it in 2019, and they have actually created such a huge program with 4 different colleges, and they don't have to seek nurses outside of that. The other thing that it also does is they are hiring a lot more from their community than they probably did in the past. So they have an opportunity to already get individuals who are connected in their environment. So I'd start there. The other thing is take a look at your residency program. Make sure that if you don't have a nurse residency program, that you're thinking about how do you support them throughout. And these residency programs are not like teaching them the skill sets. These are teaching them the soft skills, walking through crucial conversations, building in how to help them support having tough conversations with colleagues, with patients. It's okay to say, I don't know. How to support them through death and dying. I don't think anybody's prepared when you come out of school to deal with that death and dying. And we hire individuals into the workforce in the ICUs, and they're shocked. I was a pediatric ICU nurse, and I'll never forget my first code. But those residency programs help prepare them emotionally and mentally for how to support their own mental and emotional well-being.
Again, thank you to everyone. These are great questions. Go ahead and keep those coming. We have a little bit more time here, so we'll keep answering as long as you have questions for us. So the next one is, how often do you recommend surveying employees about their own workplace wellness?
Well, I think it's a challenge from a survey perspective, because you have to make sure that you are able to do something with your data. So we did it in 2022, and we made a decision that we were only going to do then micro support. We were going to do micro surveys into those areas that were really challenged in the basics and the safety areas. And we did pulse surveys that went throughout after we made change. So 6 months after we made change, we did pulse surveys. The decision was made that we were not going to do a big, large survey again until 2025 on well-being and burnout, because we were going to do the small pulse surveys instead. And that, I know that there's probably not a lot of data on that, but it was the right thing, I think, for us as an organization, because it was really paying attention to, we heard you, we did something about it, now let's survey and make sure that that's making the impact. And the other thing that you don't want to get into is just doing initiatives, right? It needs to be meaningful. It needs to be a change that, when they say that it takes at least 75 days for you to hardwire a change. And too often, because we have so many changes hitting, it comes across as it doesn't really make the impact that we expected it to make. So making sure that you're not doing more than things every 75 days, or I'd say even every 6 months, I think is a good rule of thumb.
We have another good one here. How do you talk to older nurses about not micromanaging, nitpicking the new nurses without them becoming defensive?
Yeah. So I've always engaged, truly, I've always engaged them as, I know this isn't probably how you want to become across, how you come across or want to come across, right? This isn't your intent, but it's really about the perspective of where we're at. So one of the things we did when I worked for Penn State Health, and I know they're still doing it today, each group, each team had a well-being slush fund. And that slush fund was dependent upon the retention of the team. So I will tell you that when you think about how you support your teams and letting them, how they get maybe money to work on things, or opportunities for them to celebrate or do whatever, we attached it to the entire team was responsible for the retention of their team. So it was paid out by turnover percentages. So it had you got your most amount if you had less than 5% turnover, 10% up to 10% turnover. So really trying to think through, how do you make an impact as a whole organization so everybody's engaged in those kind of conversations? If it's me as the leader only having those kind of conversations and I bring them in and I have the conversation, then it really is my problem, right? So how do we engage the entire organization? And how do I coach and develop my leaders on the unit to also be able to have those conversations? But I really do put it back to, I don't think that anyone wants to come to work and do a bad job. I don't think anybody wants to be that bully. But giving specifics and sharing what has been brought to your attention or how this may have come across, or I observed that interaction that you had with so and so yesterday. And here's how I think that could have, you know, been perceived. And I do a lot of I statements, and I think that really takes it off of the you and is more well received when I think about how it just doesn't put you on the defensive. So trying it by putting it on I observed, or this is what I saw happen, or this is what I know that I know that you want to do a great job in everything that you do. And I want to make sure that I'm there supporting you. And this is what I observed.
Excellent. Great answer. I am not seeing any more questions in the Q&A, so I think we're going to go ahead and wrap up today's presentation. We want to thank everyone for being so engaged and willing to participate in our Q&A throughout the presentation. You guys are a great audience today. We do hope you found the session valuable and gained some useful insights. A big thank you to Patti for sharing your expertise. If you have any follow-up questions or would like any more information, please don't hesitate to reach out. We will send out a recording of today's webinar along with the slides later this week, so please also watch out for that. Again, thank you so much for joining us for today's webinar. We hope you all have a great rest of your week.
Thank you all.